Hello again, I'm Fauska with Advanced Healthcare Practice, and I'm presenting today about what a nurse practitioner would do with house calls in telemedicine. So a little bit about myself. I have two little boys, Rodney and Jason. Rodney is 11, Jason is 6. That is my humble family. And my background, I am originally from Uganda. I did my elementary, high school, and sports science in Uganda. And then,
somebody's got to counteract this.
okay. All right. So then I got into the nursing field. When I came to the United States, I did an associate and then a bachelor's, and came to Texas and did a family nurse practitioner, a master's at UT Health. And so that's a little bit about myself. So what we are talking about today is understanding house calls and telemedicine offered by a nurse practitioner. First of all, who is a nurse practitioner? A nurse practitioner is an advanced registered nurse and a type of mid-level practitioner. And so a nurse practitioner is different from a doctor in that, of course, there are shorter years of study and the doctor does more. And in some states, nurse practitioners completely do exactly what the doctor would do without any supervision. But in some states like Texas, we still have to have a supervising physician check a few of our charts just to follow up. So we are trained to assess the patient needs, order, interpret diagnostic and labs, diagnose disease, treat, prescribe medication. So everything a primary care provider would do is exactly what we would do. And I'm only talking about a primary care nurse practitioners. And nurse practitioners have different specialties from psychiatry to acute care in the hospitals, but I'm going to focus on family nurse practitioner because we are the ones that mainly go in the communities. And also gerontology, who would be the one specific for seniors, but the family nurse practitioners spread along the entire span from children to all the way to the end of life. And this is the same. So we provide everything, and a nurse practitioner offers more of a holistic kind of medicine because we've been at the bedside, we've dealt with people at the bedside and interpersonally. So we do more of, benefits of, healthy living and providing mental support for, patients. Even if we may not be psychiatry, we still get into all that because we are trying to do a holistic approach than just a medical approach. So that is one of our nurse practitioners offering house calls and going to people's homes. So with house calls, we can go anywhere in the community, from church. We can go to churches and treat people there if there's like a seminar or just a workshop. We can go to someone's home, and that's what most of us do. Go to someone's home and take care of them there. While in their home, order the medication, order labs, but then we collaborate with labs for them to come and do it. We don't personally do it. We would just order them to come in, or the patient would just take their lab to Quest or wherever they prefer. Adult living facilities, and anywhere in the community, even at work. I have had to see people at work. So why would someone want to do house calls or have a nurse practitioner do house calls on them? Some of the reasons are some people are the elderly, some of them have no transport. And we see a lot of those where, you know, they would have to call their family members to come and take them to the clinic every time they needed help. But when we go to them, then they don't have to worry about transportation. The ones that are disabled, most of my patients are bedridden, so it becomes easier for them when we go to them than them coming to a clinic on a stretcher. And then anybody that would need urgent care. For example, someone will call me, they did not sleep okay, they had a cough and they're concerned, or they think they have a UTI, a urinary tract infection. So in that case, I would just, you know, evaluate them on a visit and then send their antibiotics. So that's why we would do house calls. So telemedicine. Telemedicine in the sense of why a nurse practitioner or how a nurse practitioner would do that. So telemedicine is, of course, where we use electronics to coordinate care, to do care in the community. And it's in 3 types. There is real-time telemedicine, which is, of course, when we mention telemedicine, that's exactly what most people know, where we would go on a Zoom, just like the way we are, and talk to the patient. And, you know, of course, I'm seeing the patient and how they are presenting. If, for example, I notice that they have trouble breathing, then I'm like, okay, I think you need to go to the hospital. But there are things that I wouldn't see, of course, like I'm not doing the physical. So I wouldn't do telemedicine on a physical annual visit, because then I would need to assess everything. So it would just be, you know, the basic order your medicine or something very urgent that you can explain and I can visually see, but nothing physical where I have to listen to you or listen to your heart. So that's where we would do the real-time telemedicine on a video conference. And then there is store and forward is part of telemedicine, but they all work hand in hand. So I could do a video while I'm doing the store and forward, where I'm getting your labs from another doctor and we are just talking about them. So that's part of telemedicine, or someone can just call me and say, I'm sending you my labs, let's talk about them. And then we would talk about them. And then the nurse practitioner would order the medicine they think you need based on the labs. Then remote patient monitoring, that is for tracking vitals. For example, if someone has a machine that checks their blood pressure and it is transmitted to my system. So I would check and say, okay, you know what, your blood pressure is going so high according to the numbers I'm getting, and then I would order medicine based on what's going on, or reduce their medicine if it's coming down. And the monitoring goes all the way to like blood sugar monitoring. So it depends on which ones are available to you. So why do telemedicine? It's the same concept. Someone just needs a follow-up. They came to me for a physical. Sorry, I went to them for a physical, or they went to their doctor for a physical, and they're still concerned and they're like, I don't want to go to the clinic, but I just have a question, or I have a concern, and then we can jump on a video call. So transportation, the same kinds of reasons. Okay.